Hello, good evening, good evening. Welcome to Gravity Talks.
Hey everybody, how you guys doing? So glad you guys are tuned in. Remember, if you're tuned in right now, we want you guys to like it, share it, start your watch party. If you're confused on how to start a watch party, just go to Yelverton Enrichment Services page, and from there, or you can also go to my page as well, click on share, and from there it'll immediately tell you start a watch party. Definitely want to get the word out. This is a great topic we got today. So share.
So again, welcome. Thank you for joining our Facebook Live and YouTube Live event. This is Gravity Talks. And tonight we're going to feature mental health and our essential workers. Woo, our local heroes. Yes. So we're really excited about tonight's feature. So we just give it a couple more seconds. So panelists, were y'all able to start your watch parties? Thumbs up, we're good. All right, Kim, we're good. All right, we'll go ahead and get started. All right, great evening, everyone. Welcome again to Gravity Talks. Tonight, we're going to be hosting mental health and our essential workers. I'm your host, Vicki Yelverton.
And I'm your host, Natasha Lewis.
And just a little bit of background about myself before we get started. I'm the proud CEO of a behavioral health agency known as Yelverton's Enrichment Services. We've been providing services to our community for over 15 years. I also am a broker in charge with Yes Real Estate and Construction Group. And I'm also pursuing my master's in social work. This would be my second master's through North Carolina Central University. Woo woo, Eagle Pride.
Wow, that's awesome. I guess I'll share a little bit about myself as well. Let's see, I've been working in mental health for about 15 years. I also pastor a church, Temple of Deliverance Church. We're located in Henderson, North Carolina. I have been the senior pastor there for approximately November will make 17 years. Currently, I'm attending Grand Canyon University, pursuing my doctorate. So I'm in the dissertation process, so we're right there at the countdown for that. And my doctoral degree will be in education. So definitely excited about it. Just excited to be here.
Awesome. Well, with us tonight, we're so excited about our panelists, and we'll go ahead and let them get a chance to introduce themselves. So let's see, Miss Nicole, tell the people who you are and what you do.
Hi, I'm Nicole Sullivan. I'm a safety coordinator for a construction company local here in Raleigh-Durham. I've been a safety coordinator for about 3 years. I love what I do.
Awesome. All right, Miss Kim, tell the people who you are and what you do.
Hi, everyone. My name is Kim Nixon. I am a family nurse practitioner. Right now, I am primarily in occupational health. I also do urgent care.
All right. And where did you go to undergrad, Kim?
East Carolina University, purple and gold. Shout out to all my ECU Pirates.
Yes.
And UNC Charlotte.
Yes. Look, Pirate Pride. Okay. All right. And we also have Mr. Paul Cruz, Jr., who'll be joining us momentarily. He actually is attending to an emergency. And so, again, that's the nature of our essential workers, right? So when duty calls, they must answer. But we'll go ahead and bring him in once he's able to join us, but we'll go ahead and get started.
Yes, so we'll go ahead and get started. So our first question, which is always our universal question, our first question is, what is your connection to mental health? And how has your personal mental health been impacted by this pandemic? So we'll ask, let's start with Nicole.
Okay, well, my connection to mental health is actually in several ways, but we'll stick with essential workers. So we have over 200 employees that I am the safety and health coordinator for. So it's not just about staying safe on a job, it's about your mental health. Safety actually starts at home, on your car ride to work. It starts from the moment you step foot on a job to the moment that you leave on your way back home. So if something is going on mental health wise with an employee, it's important that we're reaching out and that we're there for them, that we're recognizing those signs, that we're teaching their teammates to also recognize those signs, because that could affect their productivity and their safety of how they're able to do their job.
Awesome.
Has it been difficult for you, Nicole, kind of managing your regular duties and safety and having that job? And now we have additional measures and things that we have to take. So has that been stressful for you?
Yes, it's been intense, actually. Not complaining at all. I'm very thankful for being the one put in that position, but it is very difficult to maintain your daily, what you would normally do, and check on your normal safety stuff and the normal stuff that you would do with the guys and gals that work with us, to where now it seems like everything is COVID. And really, because once you put in a new safety plan, it's not just say, here's our new safety plan. You have to teach and train them, show them how to properly wear a face covering, how to properly care for that face covering, and then go out and follow through with that up on the job. So all the other normal stuff that you still have an obligation to follow up and train and teach is, you can't stay up on top of that right now, because this is more essential, that they know. Also, making sure that they know when to take off the mask, the face covering. That's been a big thing that I've really been stressing. Heat stress, heat stroke are major risk factors for our guys. And so when you're in a piece of equipment, I don't want them having a face covering on. They're in a piece of equipment away from people. So it's educating and getting out there to educate that, so you're not so much focused on your other daily tasks. It makes it a juggling act for sure.
Wow.
So let me ask you just one more question. So you work in construction, so it's majority males. I don't want to just assume it, but is it majority males?
Majority male, but we also have quite a bit of females, but majority male.
Great. Now, one thing that I'm just going to ask this question that I thought about is that I've noticed that a lot of guys don't like wearing masks. So how did that go at a construction site? You know, people feel like they're outside, they don't have to wear their mask. How'd that go?
That is a great question. So we're very thankful. We work with a great group of guys and gals. So they understand that we as an employer, we have their back. We understand if for some reason they have a health issue, that they are unable to wear the mask, then we are doing our best as employers to accommodate their job tasks to where they can maintain that social distance, to where they don't have to wear a mask or a face covering, only have to wear it in those cases that they can't social distance. Then also we have some that just say, you know, I can't, it makes me feel claustrophobic. Again, as long as we're maintaining that social distance, we're going to do our best to accommodate that job task. If you cannot complete that job task without doing that, then we're going to have to switch what your job task is for that day. So we're doing our best as an employer to accommodate those, but really all the guys are great about it. They really, you know, we've had a few that just not, and we worked with them to the best of our capabilities. And I don't have much resistance, but we have also done our best as employers to really fight for our workers and protecting them, and making our safety plan to where it's accommodating for what they do out in the heat. 98-degree plus temperatures, humidity, and wearing face covers 8+ hours a day is not possible. It's dangerous. So we try and implement really that social distance, and creating job tasks that we know that the guys are not too close together, that they're maintaining that 6-foot+ distance. But it's definitely I could go on and on. There's a lot of safety preventive measures that we had to put in place, from ride sharing to water coolers on the job site that we had to remove, different things like that to try and protect our employees. But they're all being great about it. No resistance.
Wonderful. That's awesome. So I'm going to switch over to Kim, and I think it's, you know, a good opportunity kind of from the medical perspective, what's your connection with mental health as it relates to this pandemic, and just how have you been connected to it in that way?
I actually do a lot of things that Nicole does because I work in occupational health. So, as a nurse practitioner, taking care of physical, you also have to take care of mental. You absolutely cannot take care of physical without addressing mental. So, what I've been doing now through COVID is I'll go in the room, and instead of saying, "Hey, how you doing? I'm Kim. I'm your nurse practitioner." I'll speak, and then I'll say, "Hey, how are you dealing with the COVID? What are your kids doing? How's your job?" I kind of make people talk to me because a lot of times, some of the physical ailments are a result of things going on mentally. So you have to address the mental aspect of it. And you just never know. People sometimes they just need a unbiased person to vent to. Some people don't realize that they have resources that they can use, and so I want to be able to be that resource for them. Hey, let's talk about this. I want to know how your mind is doing. Then we can address whatever physical complaint you have.
Okay. So have you been seeing people? Did you do telehealth, or do you actually do face-to-face now, or how's that going?
I actually do it all. We do virtual visits, which is, they can log on to the website. They can do a virtual visit. Certain conditions we can do over the computer. We do telephonic visits. Certain things we do face-to-face. It's a lot of different protocols that we have in place so that we can stay healthy. But there are so many resources out there. It's just a phone call away. You call us, and if you don't know where to go, we can tell you where to go. So we actually do it all at my office. When I work urgent care, they come in. So I may go in one day and have to use PPE most of the day. So it just depends, but we wanted to have an avenue where people can feel comfortable getting the care that they need. So I actually do all of them.
Okay. How do you think people adjusted to that shift of not being able to come face to face with you guys for appointments? How did they adjust to that?
It's an adjustment, especially for our older population. Some people don't know how to download a website. Some people don't feel comfortable. Some of our older population, they feel like it's a privacy invasion. They want to know, how can you check my headache over a video? How can you tell if I have strep throat over the phone? So it's a big adjustment, and when that happens, you have to really be creative with educating. There's already a issue with access to care and people not trusting healthcare professionals. So I try to, whoever my audience is, I try to, be creative as I can, give them resources, try to reassure them that everything is still private, but that if you need to be seen, you need to get in there and be seen. Let's make sure everything's okay.
So one more question just to kind of follow up on what you said. So how has it been effective in actually convincing them that, you can diagnose them over the telehealth and things like that? Because it's almost like, having to change our entire culture for how we do things, and so you guys, you said in your practice, you haven't opened up yet. So do you think they're ready to come back, or are you ready to come back, or?
I actually never left. My building is considered infrastructure that cannot close. So I have not missed one day of work, and I'm grateful for that. But we are starting, I do a lot of work injuries. So we are seeing the work injuries, but if you come in and you have a cough and you have a fever, we stop you at the door. We have a note on our door. We want you to call us so that we can direct you on where you need to go, what you need to do. In the case of an emergency, we'll do what we need to do. But we have phases at my job as well. We're in phase 2, which means that we're not actually seeing a lot of the respiratory type issues right now. It's a very small office, so just one exposure could wipe us out. And so if everybody's sick, then we can't be a resource for our client. So we have some things in place, and we wear masks at work. It's just about getting to know people. There are certain things that you have to be seen in person for. There are other things where if you have a medical condition and hey Kim, this is happening again, and I look in your chart and I've seen you for that a few times, I may treat you that one time and you not have to come in, and I may say, hey, if this doesn't get better, I may have to see you for this, or hey, you need to go to urgent care, or hey, I'm listening to you on the phone, you don't sound like you're breathing well, you need to go to the emergency room. So people, the main thing is people just want to be heard. So if you can make people feel like you understand them, help them get to where they need to, they're appreciative of that. So I try to be that resource. I'll say, hey, call me back. If this doesn't work, call me back. And I mean, it's been times where I said, hey, you know what? I'm going to gown up and you can come in here. Because at the end of the day, this is what I was called to do. And so if I have the proper equipment and, I have to gown up and see you because you've had a roadblock every other place, then that's what I'm going to do.
Wow. That is awesome. This is why we're doing this conversation with essential workers. I'm loving this. You guys really care. I got one more question for both of you guys, and then I think Vicky's want to chime in. But so have you guys experienced anything with like employees or coworkers where they were so worried about the pandemic and they just couldn't actually continue the job and they had to take some time off? Did either one of you guys have that issue?
Yes, we have, and we completely understood. You've got families with either husbands or wives that they have other illnesses, cancer treatment, stroke patients, things like that they have no immune deficiency, and they didn't want to take a chance at bringing something home to their loved one. And that you completely, you support 100%, but we've had a few of those, but those few have all had a loved one or a cared person that they were caring for, lived in the same home, that they weren't willing to risk it, and we 100% stood behind that.
Completely understood. How about you, Nicole?
Yeah.
Kim, I'm sorry, Kim.
We've definitely had that. I take pride in that. I communicate pretty well with my patients. So, sometimes it's just, hey, come sit in my office. Let's talk about this. A lot of times people need education. The internet is a very good resource, but sometimes if you get on there and you start Googling, you're going to be, it's just going to make you more afraid. So a lot of times, a majority of the time, if it's somebody freaking out, if I can get them to calm down, give them some things that they can do to build their immune system, give them some credible resources, tell them what I know, just have conversation with them. A lot of times people are okay. You can't live in fear, but you have to be vigilant. You have to be cautious. You have to take your medications. You have to wear your mask. You have to social distance. You have to build your immune system. So, we have to address those things. And more importantly, you have to use coping strategies so that you won't drive yourself crazy. So a lot of it is education. I'm a nurse first and a nurse practitioner second. So I'm going to advocate for the patient every single time. So my job is to serve you and make sure you are good mentally and physically. We can work through what the job says and what they're not doing, and we'll do all that later, because at the end of the day, when you're gone, they're going to fill that position. So I really take pride in, hey, sit down, calm down. Tell me what your biggest concern is. And I'm not afraid to say I don't know. I have resources. I have people that I can talk to and say, hey, what can we do for this person? Or who do I need to, let me call my primary doctor and see if you can get in. So, those are the things that make you feel like, okay, when you're having those bad days, you know what, this is why I do it. And you just do what you need to do because people need support. And a lot of times they just don't know what to do.
Wow. So I just want to kind of chime in here because a lot of what you all have spoke about is real. Again, when Natasha and I were putting together this particular panel, first, we're essential workers as well. We work in the mental health and the behavioral health space. We also do private duty nursing services. And then my husband also is the GC with our construction company. So I understood the lane that Nicole's coming from, and I understood the lane that Kim is coming from. And it's like, when you look back at y'all's own mental health and wellness, self-care, I want to kind of dive into that part, right? Because, transparent moments here, I've had times where I'm like, okay, I need to plug in some kind of way because we continue to be there for everyone else. And that's what you said, like Kim, you said you're going to suit up and you're going to be there for your patients. And Nicole, you're going to be there for the new employees that come in and have to go over their safety training. So what do you all do for self-care? Because burnout is real. And fast forward, it's been at least 4 months strong that we've been in this pandemic. And really, you all haven't caught a break because you're essential workers. You've been working nonstop, right? Mm-hmm. So let's hear a little bit about your self-care. Nicole, what has been some things that you've been having to resort to for self-care?
That's actually, I think, a very, very great question. So I'm one of those, I'm go, go, go. I also have 2 children. One of them's a special needs, has autism and ADHD. So it's different times, not just in our work field, but also in our home field. And so you're juggling a lot. I've actually reached out to my work professionals that I work with, vent and talk. We have therapy sessions to where we're allowed to do that with each other with, no repercussions. It's like, okay, here's our therapy session. We actually have a table that we'll social distance sit at. Sometimes it's just over the phone. And then also really talking to my partner, my husband, and just venting some days and bouncing ideas and things off, not just about work, sometimes about children, but most of the time about work and the frustrations and how to really, that same thing, like Kim said earlier, this is what I do. I have a passion for it. And when you see that they're worried about things, it just, your passion takes over. And it's like, I had a guy ask me, how long do we know how long this is going to last? I'm like, I wish we all had those answers, and sometimes you come home as that essential worker in that lead role and you're like, oh, how long is this going to last?
Yeah.
But I think really leaning on your support people, whether it's family, brother, sister, husband, partner, is really, really important for your mental health. That and music is my go-to. I like put on some music, I sing, and take a hot bath and relax. So
I love that, Nicole. Now I love music. I sing, but I can't sing. Does that make sense? It's in my heart though. But you're right. You have to kind of dig deep into what works for you for self-care, because you can't be any good to anybody else if you're not any good to yourself. And you have small children who need you as well. And your husband needs you and your family and your work life. So maintaining that work-life balance is key. So thank you for sharing that. So Kim, I know you have your son. How do you balance work life?
Let me tell you, I'll be totally transparent. I struggled when COVID first started. I had a few different things going on. I've taken care of people with full-blown tuberculosis, and never have I experienced this type of fear of the unknown. Am I going to get sick? Am I going to die? Who's going to take care of my child? What about my parents? I live in Charlotte. I maybe have 1 or 2 family members here, but I have a village of people, my football family, they're like my family. But other than that, my friends live out of town. And I really struggled at first. And, when you have to go from working and, you know, you come in and you kind of take your shoes off, wash your hands, and you may talk a little bit, do something, and then you may go get in the shower. But I mean, I was taking off everything in the garage except my underclothes, coming in, leaving my shoes outside, you know, running upstairs, speaking to my son and going straight to the shower, you know. And I always worried about if I get my son sick, I would feel so guilty. He has asthma and it's controlled, but, you know, thinking about him and then worrying about him having to do this virtual learning, you know, and I'm not here to help him, you know, venture through that. I had some tough times, some sleepless nights, but I have the absolute best village. You know, I have girlfriends. I have a lot of friends that are therapists. You know, I talk to them a little bit, and I actually got a therapist for myself. I wasn't opposed to that. You know, there's still a negative stigma attached to therapy in the African American community, but I just want to tell everybody, you do what you need to do to make sure your mind is sane. I had to get myself together, because how could I go to work and tell people, hey, this is what you should do to cope. You can't let this get you down, and then I'm falling apart. Because once your mind take controls and you start stressing, and then you're physically going to get sick. So I had to get myself together. I had to only worry about what I could control. I can't control COVID, but what I can do is take my vitamins, exercise. I'm still working on that. Eating better. I'm still working on that. Communicate, do Zooms, talk to your friends. I just saw my parents for the first time in months. I'm close to my parents. You know, I had some real stuff going on, and you know, I had to get myself together. It wasn't a, you know, let's see what happens. I had to, because I was falling apart. And I don't want anybody to go through that. You know, I talk to people who are doing the same thing that you're doing. See how they're coping with things. Cry if you have to, scream if you have to. But you do whatever you need to do to keep your mind together. And that's what I did. I feel a lot better now. COVID is still here, but I can cope with it a lot better. I can't control it, but I can control what I can control. So I'm going to try to keep myself healthy. I'm going to open up and talk to people. I have the type of girlfriends where I can say, hey, I'm just having a bad day. And they may not ask any questions. We may sit on the phone and cry. So what? I feel better after that. But you know, you have to open your mouth. We have to get out of that mindset of, oh, this is private. I don't want people to know I'm going through that. You know, that's how our parents and our grandparents grew up. Don't tell anybody your business, but we need each other. And so we need to open up, and we need to utilize your resources. Your job has an EAP. Call your job. Some jobs you can get 6 free therapy sessions. Do what you need to do. You know, I've had people call me just to talk at work. Hey, you know, I'm not feeling good today. You know, what can I do? Can I stop by your office and talk to you? And I'm like, oh, you can call me, because we're still not concerned about COVID. But you can talk to somebody. Yeah, you need to have a village. I tell everybody, have a village, because we all need each other. You cannot survive in this world alone. And my faith, without that, I wouldn't make it.
Amen.
I wouldn't make it. So I'm just thankful that I was able to recognize that, hey, you know, mentally I'm not handling this very well. Am I gonna die? What's gonna happen? What'll happen if I get sick? Don't think about all that stuff. Just do what you need to do to stay healthy. If you have chronic diseases, take your medicine, go to the doctor, you know, talk to our parents. I mean, you know, we need to encourage each other, and even if they don't listen, keep talking to them. So it's been a challenge, but I feel so good. I feel so much better.
And I love what you said, Kim, about the village, because the village is key. And being transparent about seeking therapy. You're right. Mental health is stigmatized, and enough is enough. It's okay not to be okay, and it's okay to seek help. You know, and it's kind of like you said, being a little hypocritical when we're responsible for others' lives, And we're trying to instill, skill building and trying to teach them and model for them how they can live a wellful life per se, taking care of ourselves, know. And so I really appreciate, you being transparent about that. Nicole sharing, what you all need to do to plug in, because that's what people want to know.
Right.
They want to know the real. They don't want to know the fluff side of it,
Right.
And then they want to know also too why essential workers are so passionate about maintaining and people wearing, and I don't know how you all feel, and I'll let you all speak for yourselves, but wearing the mask or just practicing, the social distancing, just doing things so that, like you said, so you can go home to your children, your family, and feel as safe as possible and make sure they maintain their safety. Because people forget that you all put all that on the line and at risk every day. You go in, check out, clock in, clock out. And even with you doing virtual sessions now, and we're doing virtual as well, like you said, there's those clients or those participants who need us face to face in person. And, I appreciate the bravery. I think me and Ms. Lewis can stand up and show our shirts, to let you all know. Again, salute to frontline workers.
Yay!
I love them.
Thank you.
Yes.
And so we really salute you all, and we want to have this panel so people can see that you are appreciated. You are appreciated. We are continuing to depend on you all. We are going to continue to count on you all. So thank you for sharing that again, regarding self-care.
Thank you.
I was kind of curious, and I definitely thank you for sharing, because I watch the news, and I probably watch the news more than I should. And in watching the news more than I should, it's kind of like, yikes. I heard the word nurse. I'm like, oh God, is she okay? Because it looks like from the news perspective, you guys are just being overworked. In construction, you guys haven't stopped. And I'm still trying to figure that out, but we won't go there, but I'm going to say it anyway. But I'm still trying to figure out if everything's shut down, you guys are building and putting together stuff. And I'm like that, it was just like, they need a break too. I was kind of thinking that, but, but definitely just kind of like the impact on your kids. Like, how do your kids feel? Because kids know more about the pandemic and what's going on. They know more about it than I think that we give them credit for sometimes.
Yeah.
Because I had a 7-year-old give me a lesson on quarantining and 8 years old. It gave me a lesson on it. And I'm like, I've never heard that before, but it was absolutely accurate. So how is that transition? Because I know, Kim, you said that when you get home, you would take off everything in the garage. How did your child respond to that? Because I've seen a lot of different commercials and things with doctors and nurses coming home. How did that go?
So my child is, he's very nonchalant, laid back. So I've always been in healthcare, so we always have washed our hands, and I haven't sat in my work clothes on the couch and just lounged around, but I had to sit down and have a talk with him. I worked a lot of late shifts, and I had a lot of guilty times when he would say, hey, you coming home late again? But I had to talk to him, and I said, look, we really got to wash our hands even more than we do now. And you're going to see me wiping down different things and using the Lysol more than you thought. But, when I come home, don't come near me, I'm going to be in my bra and underwear. If you pass me in the hall, keep it moving, buddy. Don't try to hug me because I need to get clean. And so he understands. His dad is in mental health, so he talked to him too about this. So, thankfully, it hasn't really been an issue with him, the whole COVID stuff. I think the biggest thing for him was the whole school transition, and not being able to see his friends. So that wasn't really an issue. He's a preteen, and it's just a part of our life. Your mom's in healthcare. I think the thing that really made him say, oh, wait a minute. I told him one day, I said, hey, there may be a time where I might not be able to come home at night, so we had to put an emergency plan in place. Hey, if I have to go, if something goes on and I have to go work at the hospital and I can't come home, this is who you're going to call. This is what you're going to do. So I think at that point, he was just like, whoa, wait, hold up. Are you going to die? He'll ask that. And I'm like, look, I have to take care of people. Worst case scenario, that could happen. Best case scenario, I'm coming home every day, but we got to keep ourselves healthy. We got to pay attention. We have to follow our emergency plans. Now, I believe in an emergency plan. So we have a plan in place. If I call and say, hey, I got to work at the hospital, I can't come home. He knows what that means. He knows who to call. He knows what to do. So hopefully that never happens.
Yes, prayerfully. Yeah. How about you, Nicole?
Well, very good question. I have two kids. I have an 11-year-old daughter and a 12-year-old son. My daughter, like your son, Kim, is asthmatic as well. But the thing that bothered her the most about all of this was she missed her 5th grade graduation. She didn't get to say goodbye to her friends. She didn't get the 5th grade graduation stuff. And, so I have a sign in the yard for her, and we try to make it special and do some stuff, but it's not the same, Mom. And then our son, he's a character. He is a little bit more fearful, obviously. He did a lot of research on his own, which is kind of scary. It's one of those that, son, everything you read on the internet is not true. Kind of, you have to rein it in. He has autism, and so he tends to hone in on certain things. And so he actually, I'm so proud of the virtual schooling. I thought it was going to be a lot more difficult, but he really just triumphed through it. He had a good support team through the school. I would transition with him in the mornings. Then we had a friend that would also help transition, and it was smooth running. I would just say the hardest thing for him is really the leaving the house factor. Like, he really bad needs a haircut, and he's like, no, I'm not getting corona. I'm not leaving the house. I'm like, okay, well, how about you let Mom cut your hair then? Nope, you'll cut it too short, and I'm not getting corona. I'm like, okay, well, we'll work on this. I accept what you're saying to me right now, and we'll work on this. So we're working on the haircut. But it's not, but he has at least progressed to making it outside. We've done a couple bonfires, and so now he realizes he can come outside on the front porch and he can go around by the fire. We've made it up to our lake place to where he knows that those places are okay. But initially, just going out even on the front porch, he wouldn't come out. He would keep the door shut. He's like, nope, not getting corona. But we're transitioning. We've made some improvements there. But that's, like what Kim said, they appreciate what we do. They know that Mommy's still working, Daddy's still working. But we also have those safety plans, safety protocols put in place when they come in. Nobody's touching me. I'm washing up to my elbows. We also have a friend that is a stroke patient that resides with us as well that I care for, or help care for. So we have a lot of safety protocols put in place before I ever even enter the door. And then once I enter, it's much like Kim, going and showering, cleaning, and just trying to make sure that you're keeping everybody in the home as safe as possible.
So I had a quick question. So as we talked about self-care and we talked about how the kids are really in tune to what's going on, my kids were watching CNN as much as I was in the beginning. And then we had to wean off of that because I said, like Natasha, I was like, if I watch another show, we all gonna self-diagnose. Mm-hmm. So, but one of the things kids are asking about is vacation, and same for you all. It's like you're an essential worker. You've been working pretty much nonstop during the pandemic. You haven't been able to take any time off, or have you?
Not really. My job just implemented a thing where now if you go to we call it a COVID state, for example, New York, when you come back, you can't go to work for 2 weeks. You have to use your paid time off. So if I was thinking about going somewhere, I don't want to be off for 2 weeks and have to use my fun time, but things are changing so much. I mean, I really haven't been anywhere, and usually summer is when I travel. So it's been difficult, but I've been able to, do some things around the house that I have been putting off, and save my money, just different things like that. I mean, if me not being sick means I can't go overseas somewhere, I'm okay with that.
Yeah. How about you? And Kim, thank you for that, because I know you like to travel too, like I do.
Yes.
And I know you was posting some memories about your previous girls' trips, and I'm like, I'm
Yes.
with you there, Kim. I'm with you there,
Yes.
sister. You know, but this too shall pass. We'll
Yes,
be
it will.
those PTO days soon. So, what about you, Nicole?
Well, we had plans to take our children. Their birthdays are at the end of July 30th and 31st. So we were going to take them to Florida. However, that has been postponed because, just like Kim, we have a policy depending on if it is a COVID state or what we call a high-risk state. It too is a self-quarantine 14 days requirement, in which I'm not willing to put myself in that position, or my family for that matter. So we're doing the lake, which is 45 minutes away, and enjoying our summer the best that we can. I'll take a longer weekend sometimes, so work a couple longer days and then take a Friday afternoon and then do a longer weekend. Only because this is the only summer our kids have, and who knows what it's going to look like for the school. It's still up in the air. But I'm trying to make it just as fair for our children in our home as what I am out to our guys out in the field. It's a juggling act for sure, and I'm sure Kim is in agreement 100%, is definitely that juggling act, and I hope that you get your girls trip coming up, so for sure.
I'm praying.
So let me, I want everybody to get a trip. I'm telling you, I have that itch right now that I see airplanes every day. Every single day I see airplanes, and I'm like, and in my mind, I'm thinking, okay, are they bringing the COVID here, or are they taking the COVID there? And that's kind of what I'm thinking, because that they're talking about, these restrictions, you can't travel here, you from here, and all that kind of stuff. So I'm like, look at a plane, and I'm like, oh boy, and it makes me say, well, I believe I'll stay home again this month and the next month. But I'm just curious to see, because honestly, you guys are kind of like on edge about doing anything at all times. At work, it's a risk. If you go somewhere, it's a risk. It's a risk. It's almost like you guys are really stay at home order. You're at work. It's almost like, because you can't really expose yourself to anything, because it'll keep you from working, or you won't be able to be around your families. It's just a lot that I think that one thing that people don't realize about essential workers, I think that now we've really come to a place where I think the world has grown to really appreciate you guys, because with something like this, you guys didn't get a break, and you never take a break. So I think it's really commendable that, and if you got my vote for getting some extra PTO, if it's a rule we can pass right now.
Watch it.
Working on it for all essential workers. Come on, everybody. All those that are live right now. Come on, let's take a vote right now. Get this bill passed right over over the live streaming. So,
but Natasha, I was just going to add, Natasha is our day treatment program director, and so that's why she's really advocating on y'all all's behalf for this extra time. But one of the things too, as an employer, is that we had to check the pulse of our team, and even though we were working virtually and working, through telemethods, the burnout was still real. Like, I couldn't believe how tired and how mentally strained we all were. Like, we would do our weekly Zoom meetings, and I had to take a snapshot of my team to say, look at how we look on this Zoom, and it was interesting because, I had to realize that there's still the mental exhaustion that's occurring. that just because we're not physically getting in a car, driving into the office to work, we're still putting in that same amount of effort, if not more, to maintain our workload, our caseloads, and to maintain that level of professionalism with our participants. So I think it's important, like you mentioned, Nicole, your employer understands that, there's certain things that need to happen to continue rapport, and to maintain morale. And us as Yelvertons, we try and do that as well. And so Natasha, again, I call her the union rep. She'll go back with the team and talk to them, and then she'll come back and try and negotiate with me and Mr. Yelverton, and we say yes or we say no, and so, but in the end, I mean, it's all about balance. And so I think it's key that employers really remain cognizant of the needs of their team.
Now I just want to bring this up. Now, of course, I started back watching the news. I think I maybe stopped for a day, maybe a day. But with the spiking in the cases and this reopening, this open this, it just kind of, to me, the way the cases are spiking, it just puts people that really have to work. And I'm not saying that everybody doesn't have to work, but the nurses and, the frontline workers and things of that nature, it's kind of putting everybody at in jeopardy as far as like with schools opening up and things like that. How are you guys actually feeling about that as the essential workers and those that have kind of been exposed to all of this time? How do you guys feel about it?
I'm not surprised. If you think about when COVID first came, it was a lot of restrictions on people even able to be tested. So of course the number of cases are going to go up because now we are able to test more people. So that's one of the reasons why the cases is going up. It's summertime. People want to be outside. People are tired of the virus being around. People are tired of being restricted. My main concern is not so much of, okay, we're still dealing with COVID, but are we going to have enough hospital beds if people need them? If people need to go to the ICU, are we going to have enough ventilators, things like that? So that is my main concern. I expect the cases to go up because we're testing. Just about any symptom can be considered a COVID symptom now. Whereas in the beginning, if you had to have a cough, a fever, or shortness of breath. Now, I mean, people are walking around with no symptoms and they have COVID, but they can get tested now. So I expected that. But my main concern is, let's try to do what we need to do to decrease exposure so that we can kind of get back to some kind of normalcy. I mean, we'll be in flu season soon. Flu season on top of this stuff, it's going to be a lot this fall. So it's just one day at a time. That's really all I can do. We get memos from Department of Health and Human Services, CDC, all that stuff all week. So stuff changes every day. So just day by day.
Okay. How about you, Nicole?
I agree with Kim. It is definitely day by day. I agree with Kim too on that. Is my biggest fear. Are we going to have enough hospital beds? Are we going to have enough respirators? Are we going to have the PPE that is needed to care for these families? I, not so much as in my field, when it comes to the health of our employees and our workers, I that comes first. So to me, if we had to, we would do whatever it took to protect our employees. But that's why we have put these strenuous things in place now, not just the social distancing, but there's a lot more of other things that we have put in place to try and do our best as essential employers for our essential workers. But I'm right there with Kim. My greatest fears, and especially with schools opening back up, I think it's a whole lot of still unknowns. And it's unknowns not just for medical workers, essential workers, it's unknowns for families, teachers, children, educators, pastors. friends, neighbors, and every time you sneeze, is that COVID or do you have allergies? And now that they're doing more testing, like Kim is saying, I think we're going to find a lot more cases, a lot going up and higher and higher. And I think it's going to bring on new, interesting times. And I think that what we are used to as normalcy, we need to start creating in our brains a positive mindset of understanding what our normalcy is no longer our normalcy. And
Right.
we need to start creating that positive mindset of where we can go with our future with our new normalcy. Because I don't see this ending. Kim, correct me if you feel I'm wrong here. I don't see this being something that changes anytime soon, especially going into flu season. I see us having permanent changes in all that we do.
Mm-hmm.
Yeah, I think I agree. I think that it's I don't want to say new normal, but because I don't want this virus to define where our life is going to be from now on, and so I don't want to use the new normal because I think that regardless of what's going on, we can, as we've been doing now. Creativity has taken a the forms of entertainment. Everybody's adjusting, and it's just a matter of adjusting to a crisis. So I think that that's really, really important. You said something earlier, Nicole, that you listen to music, and I was just curious as to what was your go-to song. That there's always that go-to song that you have to hear it at least once a day. What is it? I just gotta know.
I know you're not going to believe me, but I don't have one go-to song at all. I really don't. I have a huge genre of music. So sometimes it's upbeat, random things like girls just want to have fun. And sometimes it's like old rock and roll. I love good country music, and then I also love gospel. So it just depends on the day and the mood and the need. So
I got you. I was just curious if you had that song. I just forgot to ask earlier, and I just had to ask before this was over because I just wanted to know. Because then every time I think of you, I'm thinking of that song. So just was curious about that. How about you, Kim? Do you have like that one song that just sets you right for the day and makes your mood straight, or gets you, makes you forget about everything?
Girl, I might be listening to Mary Mary and then Dr. Dre.
Hey.
I like to joke and have fun. I like to cut up. That's how I release a lot of stress. I like all kinds of music, but I love me some old school rap music. Everybody that knows me knows that. I like old school. I like old school groups. I like country too. Yeah, so it depends, one song in particular, Yolanda Adams, Open Up My Heart. Sometimes when I'm really having, a tough time emotionally, I'll listen to that, or I'll listen to Mary Mary, Just Can't Give Up Now. That got me through graduate school. So I have my go-to favorites that remind me that, hey, you were called to do this, and this is gonna be okay. And sometimes I'll put on some gangster music and get my little, and then I'm okay. So listen, it's been times where my little headphones come out of the phone and I'm like fumbling, because I don't want it to be loud in the office. It's no telling what's gonna be in my ear.
What do you call that little shoulder thing you just did? Can you do that one more time?
I ain't really gonna do that on here, but
you don't want us to turn it out now.
Man, listen. They laugh at me at work because you gotta laugh. I've had people. I post funny things on Facebook all the time. You know how many people I've had message me and say, "Hey, you know what? I've been going through some things, and you are crazy. You are funny. You make me laugh, and I'm gonna keep making you laugh." So if I ever get quiet and you haven't heard from me or seen me, something's going on. I like to laugh. I like to have fun. That's an outlet for me. So if I can make people laugh and have fun, I'm gonna do that.
So how about you, Nicole? How's that work environment?
Well, I had a quick question for Kim.
Okay.
So has your son asked you to do a TikTok with him?
Let me tell you about that little boy. That little boy he's so cool. Like, I'm not doing, he thinks I'm so corny, but every day he'll say, you got more sneakers than me. Like, he low key knows I'm cool. That's where he gets his swag from. But no, he probably would never ask me to do a TikTok. He thinks he's too cool for that. So now if his friends do one with their parents, he might, but he thinks I'm corny. He thinks I'm so corny, and that's okay.
Well, so that has been, I come home one day from work and make it 2 steps up on the porch, and my daughter's like, Mom, do a TikTok with me. I'm like, a what? She's like, a TikTok. And I'm like, okay. She's like, it's easy. So I had to learn to dance in like 5 seconds.
Oh, wow.
So corny.
That's
it is
fun.
so corny. I look terrible. You shaking. Oh yeah, totally embarrassed myself, but I did it.
Hey, I love it. I love it.
It's definitely been a lot of TikToking going on, but guys, we this has been so awesome. I'm going to tell you this because, like I said, the TV, the news, they only give you one side of essential working life and things of that nature, and only certain perspectives. We see the bad for the most part. We see, the horror stories, which, they're all true, very relevant, and, to in some ways help to promote the seriousness of what we need to do as safety measures for ourselves and to protect our families. And so I definitely want to say, thank you guys for sharing today. At this time, we're doing something that we call full circle. And our full circle moment for today would be, let me make sure I get it right. What would you have as words of encouragement for the essential workers in your field, or just the essential workers that are out there? And just to kind of give us an idea of some encouraging words, or just some additional, thoughts or ideas that you would like to share with them and leave them with what particular message would you like to leave everybody with in regards to your area of essential work and those that, work with you and things of that nature. Nicole, you can go first.
What I would like to say for construction industry in general, but all essential workers, is to understand you're not alone, and to look to your supervisors, to your safety coordinators, to your healthcare providers like Kim, and know that if you have a question, you have a fear, and just, if you're the type of person that holds it in, that's understandable, but sometimes it's best if you talk about it. If you have questions about COVID, if you have questions about or fears about working in the field or in whatever job task that you're in, really asking and taking the time to reach out to somebody is the best thing that you can do. And it might be somebody like myself, or your supervisor, or a doctor, or a psychologist, somebody, but just reach out. Don't hold it in, and don't let it eat you alive would be my biggest thing. And just knowing that people are there for you. I'm there for our guys day in and day out. And so are our medical professionals. We have psychologists available. There's also, as Yelverton has provided, hotline numbers, and a lot of people feel alone right now, and that's scary. It's scary that even though they're at work, they feel alone. So just talking and communicating and reaching out to somebody and letting them know, hey, I'm scared and I feel alone, is really important.
Thank you for that. And how about you, Ms. Kim?
I just want to, let the essential workers know that use the buddy system. Even though we might not be able to travel, go to your manager and say, hey, I need a break. Let me have this day off. Go to your coworkers and swap off shifts. Do whatever, work half shifts if you can. Do whatever you need to do. Talk to your friends. You can do Zooms or phone calls, or just celebrate different things. But just don't hold it in. We need to be healthy mentally and physically for our patients. So don't be afraid to say, hey. You can even say, hey, I don't know what I'm feeling. I just don't feel right. And, somebody needs to know when you're feeling like that, because we don't want you to hold it in and then have a breakdown or get ill physically because you didn't say anything. Open your mouth. It's okay. We're all human and we need support. So open your mouth, talk to people. And, as friends, we need to stop saying, hey, you need anything? Are you okay? Call me if you do. No, hey, you know what, Vicky, you don't look right today. I'm coming over. I'm coming outside. Come on your porch. And don't take no for an answer. That's what we need to do. Don't allow them to say, no, I'm fine, and you don't hear from them for a couple of days. Or you can look at your friends and say, something's going on. I'm coming to your house. Open your door. I'll stay in my car. We're going to talk, but something's not right. And I want to find out what's going on with you. So I think we need to do more than that. Get in their business. So we need to take care of each other. So I want everybody to remember that, and don't be afraid to get help.
Thank you. Awesome. Thank you guys for sharing. Vicki, you got any last words you want to share or message you'd like to give to our essential workers?
Yes, ma'am, of course. Again, thank you, ladies, for joining us tonight. It was an honor and a privilege to collaborate with you on this panel. And it warms my heart that when I reached out to Kim, and I know when Ms. Lewis reached out to Nicole, without any hesitation, you all were like, I'm there. Thank you for including me. And I truly appreciate that, because it goes beyond just the four walls of your workspace. You carry that into the world. And that's the purpose of the Gravity Talks. We want to bring awareness and how mental health is a common thread amongst all aspects of life. And so, especially during this pandemic, we forget about our essential workers, and you all are on the front line. And we truly, truly appreciate you putting yourselves in harm's way, putting yourselves at risk, and not just physically, because some things are being done through telehealth, but mentally. Mentally, you're giving a piece of yourselves for us. And so truly appreciate you doing this great work. So again, ladies, thank you for joining us tonight. I want to give a shout out to y'all. The timelines have been flooded. Y'all's followers or fans or our viewers have shown a lot of love tonight, and I truly appreciate that. I have so many different posts that I've been trying to keep up with to post as you all were speaking. And there's a lot of love that's been given out to both Nicole and Kim, and also Ms. Lewis and myself. And I truly appreciate our streaming audience. I do want to give a shout out to all the essential workers out here. I have a few cousins that are essential workers. I got one who tuned in from Maryland. She said, great job, ladies. Cheryl Mitchell. That's my cousin out there, and she works with the post office system. So she's still been working as well. There's some therapists up here. We got Mr. Rob Fields. He's a psychologist, LPA. Who has been collaborating with us on some previous panels. So he said it's been a great session, ladies. So he wanted to give you all kudos for that. There's been so many hearts, so many pounds. My husband sent a hand clap, just standing ovation for this particular panel. Miss Yvette says, thank you, everyone. This was a super amazing panel. So all this love. Mo from New York. Chimed in. She said, great job, ladies. So I just wanted to just let you all know that you are appreciated. We had an abundance of love shown through our viewers tonight, and they have been transparent in their gratitude towards you all with their posts. So again, I just want to say thank you.
Thank you
very much. Thank you so much.
So, and then my closing remarks, guys, I just want to say that, there's so many essential workers we definitely want to do this again. We want to, because we can only cover a certain amount with the squares, but we definitely want to have a part two to give the people that have been out there working through all of this, give them their voice and let them speak. Because sometimes, advertisement, news, and those type of things don't quite give the clear, correct message. And so, we just want to, again, can't say it enough, say thanks. And thanks for being a supportive person to everyone else. On top of doing your job, you guys are still moms, wives, friends. It's a lot for you guys, and along with the pandemic all at the same time. So we want to thank all of the essential workers, every last one of them that is tuning in right now. Definitely want to thank you. Before we close tonight, guys, at 9 p.m., we're going to do a recap over the session for today. So we're going to have a couple of people that we're going to just call in, and they're going to give us our feedback for it. So it'll be about 5 or 10 minutes long, and we're going to do that. So if you guys at 9 o'clock, we're just going to jump back on real quick. It'll just be Vicki and myself to do a recap of the show, to give us some feedback and probably some tips for our next mental health and essential workers. So definitely, guys, the key words that we heard tonight was self-care, taking care of yourself mentally, emotionally, and physically, and making sure you have somebody to talk to. Those were the key things. So that's the takeaways for this evening. We're so glad you guys tuned in. And guess what, guys? We'll see you at 9. If not, we'll see you. And Vicki has one more thing to add.
I wanted to go ahead. I did have it scroll across the bottom, the Alliance hotline number, the Access to Care. They are open 24 hours a day, 365 a year. And their number is 1-800-510-9132. Again, that's 1-800-510-9132. And then the Suicide Prevention Hotline number, again, they have a toll-free number as well. And it also is the number for Veterans Crisis Line. So if you're in need, please reach out to that number. And that is 1-800-273-8255. Again, 1-800-273-8255. So please utilize those resources, team. Got it.
All right, guys. Thanks again. And we'll see you next. Oh, yes. Our next panel is going to be absolutely awesome as well. But we'll tell you about it at 9 o'clock. But definitely
at 9 for after the talk.
So definitely hand claps and applauses to our. Come on, Vicki. You ready?
Yay!
Frontline workers. Thank you, guys. We'll see you soon.
Thank you. Bye-bye.
Have a great night. Thanks.
Bye-bye.